Welcome to the Spirit of a Badass, where we celebrate stories of courage, hope, and resiliency. I am your host, Alecia Jacobson. Hello, welcome. My guest today is back for a second time, which I'm super jazzed about. I have Dr. Tes Jordens, and I actually got to have lunch with her earlier this week. She was in Madison, and so I got to meet her in person, which is always a treat. I feel like I have guests on here, and it is so I'm doing this obviously to enrich my listeners and to bring these guests to you, but let me tell you, my life has been so expanded and just enriched because of the women I get to meet that come on here, and then I get to create these connections with them outside of the podcast. So it's been really cool. So that was really fantastic to be able to meet with her. And so we had already had this scheduled for this week also, but there's a few more things that I want to bring to it just after chatting with her. But I'm going to give her a little intro again here first, in case you didn't catch the first episode that I did with her. Dr. Tes Jordens is a double board certified physician and menopause certified provider who founded in 1988 a telehealth practice focused on redefining midlife care for women. Her work centers on hormone health, weight care, and whole person wellness, with a strong emphasis on listening to women and providing care that goes beyond dismissal and outdated norms. Dr. Jordens is committed to empowering women with knowledge so they can advocate for themselves and thrive in midlife. Welcome.
Thank you. Thanks for having me. And yes, It was so nice to meet you in person.
Yes. I was telling you that I had seen another woman that I had interviewed a couple weeks back, just as a random encounter. And it's like, I feel like I know you guys so well, because we have these conversations, but I'm like, oh, I guess I've never actually, I've never met you, but it's weird this kind of being, here, and then also social media. It's like you feel like you know people and you've never actually met them in person. It's just this weird space to be in.
It is. Yes, that is always a strange feeling, because I think social media does that a lot too, because there's a lot of people I feel like I know who have no idea who I am.
Right. And then if you meet them, it's like I'll have people, we shared about this, I'll have people who I listen to your podcast and I don't really know them well. And I sort of get this holy shit, what did I say? Even though I'm pushing record and I'm saying it, but I'm always like, oh, what do you know?
Yes.
All right. So the last time we talked, we talked about 1988 wellness, but I don't think we really went into it a little bit deeper. And I would like to share, because it's every single woman that comes into my sphere that I do coaching with, this is a piece of it. So I know it's my age, obviously, that I don't work with a lot of early 20 something ladies, but could you please tell us, if a woman comes into your world and has a discovery call with you, I like in your intro how you talk about, you really listen. And that is the great thing about kind of this new healthcare model that we are seeing of it. This is not a 7-minute or a 20-minute appointment. This is an actual, you are asking questions, you are seeing things, you are going beyond the blood pressure or whatever the things are that we go in, and the doctor, and I get it, they don't have time to do all of this, but what does that look like if in the discovery call, and then if somebody works with you, what does that all look like?
Sure. So the discovery call is set up because I also understand that, like you just said, even if, for example, someone recommended me to them, or they heard it on a podcast, or they saw it on social media, they still might not be sure that this is a commitment that they're ready to make, because it's a different type of healthcare relationship. So it is more like a partnership or a commitment. So the discovery call is there for, really, it's their time. Is it asking me questions about, who I am, my training, what this program is like, what is it like to work with me? Or sometimes women will just say, I have this. Can you help me with those things? It's a way to dip your feet in, make sure that me talking to you sounds like a good idea. Like, oh, okay, I could work with somebody like that. And, or it doesn't come up often, but maybe there is something that they're looking for that, I'm not an endocrinologist. So although I could test someone's thyroid, I'm not fixing complicated thyroid problems, so
Mhm.
something like that. But that's something they can clarify. So that's what I recommend most women do, unless they're like, yep, I'm ready to make this commitment. And then the initial visit or the consult is, yes, when I spend, it's a 60-minute visit. More than half of it, 2/3 of it, is spent with us, me listening and with us talking. And so usually it's the first whatever it takes, but at least 20 minutes usually is spent with the patient telling me, what's been going on with them, what their goals are. I always ask the question, especially if they don't know where to start, if you could, have a magic wand. I got this from my mentor. If you could wave a magic wand, what would be the one thing that you would change now, today? And so sometimes that gets them thinking more, okay, it's my energy, or it's my libido, or whatever it is, so that they have something to focus on initially, because usually they're coming in with lots of symptoms. And the good news is, I always say, like, I know we can get you feeling better, right? It might not be 100%, where I usually say we're looking for like 70 to 80%. And I'm not saying you couldn't feel wonderful and 100% great, but we all have like up days and bad days. And so, but I know, women will feel better in the end. So focusing on that one thing. And then usually it's a piece about education. Whatever came up in the discussion, especially if there's some concerns they have, or hesitations, or something someone told them, or their mother told them that's why she had breast cancer, so don't take hormones, or whatever the thing that comes up, then we usually spend a good deal of time talking through that and doing some education. And then the last bit of it is making the plan of what happens next, because usually it's not just, even if it is medications, it's not just like, here's a bunch of medications, good luck, that kind of thing. So it might be like, this is the next step. And then, 2 weeks later, I want you to do this, and, communicate with me, in between. And that's the other thing. This is why I built the practice this way, is I very much didn't want it to be like, here's your stuff and I'll see you in 3 months or whatever. So the membership is built so that if there is a question or something comes up, they can send me a portal message, or, there's more ways to communicate in between appointments if need be. Now, not everybody needs that, but I do have some patients that's very beneficial to them.
Yeah. It's nice to have that option in this sort of relationship too. Whereas this is, like you said, this isn't here, take this, I'll see you in 3 months. This
Mhm.
is, you get that added level, which I think so many of us are craving and
Yeah.
really, really need to feel almost like we have to go out and gather all this. Like you said, somebody might, part of it is education, because we hear these things and it's, we can go on Google, we can ask Chat GPT,
Mhm.
we can do these things, but it is not for us personally. That is a
Right.
generalized, recommendation, or it could be real, it could be not true, it could be like the
Yeah.
accuracy, we don't know. And having that added layer to communicate with someone who has our back, it's almost like we can put down some of that weight of figuring it all out, because I feel like we all have to be detectives in this and try to figure out, what the hell are we doing? Why do we
Yeah.
feel this way? And then piecemeal it together. So even if you're saying like some people don't, to know that you have that there, it's like almost like an exhale of like, I don't
Mhm.
have to worry about that piece. If something comes up,
Right.
I have this like safety net there of somebody
Right.
who supports me.
Yeah. And like you said, nowadays, yes, you can Google and search, and there's like a million books, and ChatGPT will tell you whatever you want to hear. But sometimes, like you said, is that information accurate? And then the other is just, there's so much. Like, I find that with business stuff, because that's not my forte. And yes, I can look stuff up, but many times I just want to hear from somebody who's done it before, who's been there before, because again, there's 25 different opinions
Yes.
out there, and I don't know which way to go. So I understand that the same thing happens, especially in like the health and wellness space.
Yeah. Yes. Okay. So I sign up with you. We've kind of already got into it, but like what happens next? You said a membership. Just give a little bit of a container on what that looks like.
Sure. So the way that I have it set up now, and it's, again, I've been doing this 8 months now. Yeah. And so it's evolving after working with patients and seeing what would work best. So right now I have a 6 month membership, but I will also be extending that to a year. And basically, it's ongoing. So you make your initial appointment. I send you a pretty lengthy, but it's very helpful to me to know where we're starting from. And so that we don't have to go through all those, like, what medications are you on? All those kind of things.
Yeah.
But I need all that information, of course. And so they complete that. Then we have our initial appointment. And the way that it used to be set up was like, okay, then you would have an appointment this far out and then this, but I want to make it more fluid. So basically, again, it's available. Honestly, if you need to come see me, come see me. If you need to see me every 2 weeks, yeah, I mean, by all means, we can do that. But again, most women don't have time for,
Yeah.
for
I
that.
was just going to say, knowing that it's available is a great thing. And also, it's like, oh, if I don't need it, like nobody wants to spend their time doing anything they don't have to do.
Exactly. Exactly. And then I think too, it's like, because sometimes a follow up is like everything's going great and I don't really have any questions, but as a healthcare provider, we do want to know that. When I worked in primary care, you'd have a conversation with somebody and you'd make suggestions or medications or whatever, and then you might not see them back for like a year. And so you're kind of left with like, did that work? Did that help? I don't know. They never came back. Nobody ever said anything. And so that's as a healthcare provider, that's a really uncomfortable place to be. And so I also, because I get to build this however I want, part of it is also for me, like, are these things that I'm suggesting or trying to help with, are they helping? Are you having any issues? Because the other thing too, I think often, especially women, if something's not working, then they're more likely to be like, oh, well, it's me. Dr. Jordan said if I took this and I did this, then I would feel better, but I'm not feeling better. And so then they're going to be like, that's just me. It's not that the hormone isn't working or whatever, or this plan isn't right. And so I think kind of, I don't want to say like forcing, but like encouraging them to have that freedom to come back and be like, what, for whatever reason, this isn't helping as much as I thought. I think that works as a better system both ways.
Yeah. Yeah. Them advocating for themselves. And I also, when you said, when you were in primary care, you would, either prescribe something or suggest something and you don't really know. This has to be really nice too, because you get, like you said, you get to design it. And also then you get the feedback of constant information coming in of women and what they're doing and what works and maybe what, you can see that. And I'm guessing that kind of fortifies your practice also because you're getting
Right.
that touch point constantly of what works, what doesn't. And I guess, I know it's different for every woman, but you can kind of,
Right.
you get a lot of data coming back to you.
Right. So yes, that's really helpful. And that is part of the reason why it is evolving. I feel like anything that we do should be evolving over time, whether it's with each individual patient or just how this looks overall. That's super important to me. It's helpful because I want to know that my patient is beginning to
Yep.
feel better, but also it's helpful for me from a business end of things to know whether my idea works.
Yeah.
Yeah.
Excellent. Okay. Anything else that would be helpful for the listeners to know about what it would be like to work with you?
So I guess the biggest thing is because I'm a physician and I can prescribe, I think that's a lot of the time what women think they have to come see a physician for. But that's, at least in the way that I would like to practice, it doesn't have to be that way. Like, there never has to be an exchange of a prescription, because there's lifestyle interventions that I want all of my patients to make. And so if that's the only thing that they need help with coaching on, right, as a physician, that education piece, you could call it coaching. I just feel like that's just kind of the piece that I like to do. And so more than happy to help with any of those things as well. So it doesn't just have to be about medications or hormones.
Got it. Okay. All right. So this is a perfect segue to one of the questions. So I'm going to kind of jump around here. There are women who do not want to take any sort of prescriptions, medication, and things like that. And they are feeling unwell because
Mhm.
of perimenopause and menopause. So take us through that. What does that look like for a woman who does not want to take anything? And how do you work with them? What does that look like? And I know it's different for everyone, but just
Right.
a general idea.
But you're right. There is there is a through line for everyone. And where you fall on that is going to be different. And I always tell patients it's nothing you've never heard before. It's more just getting it directly from one person and then having that accountability, I think, is what's different. Of course, how we fuel our body, even if you decide that you are going to take hormones or you're going to have some sort of medicine intervention, you still there's nothing magic about those. They can be helpful, but if you're not doing all the foundational like lifestyle things, you're only going to get so far. So of course, how you fuel your body. And for me, it's healthy proteins. It doesn't matter to me if you're doing animal or plant proteins, and fiber. And then fiber is mostly from fruits and vegetables. So even if you're just doing those two things pretty consistently, not perfection, but just consistently, that's going to help significantly. And then I always talk about movement versus exercise. I feel like exercise just feels like stuff people don't want to do. And so I try to frame it as more movement. What movement feels good to you? What can, again, consistency, what can consistently fit into your life, your schedule, and is not going to injure you and is not going to make you feel punished, but it's actually going to help you feel better. If you're going from like pretty sedentary, not doing much physical activity, no matter what you do, there's going to be some, difficulty there initiating things. But again, I think that's what's helpful about having, some accountability. And then working on things like your sleep and mindset or your stress recovery. I kind of put those things together, but they, technically, I think there are two separate things. A lot of those lifestyle things come down to that mindset piece of,
Mhm.
I can't do it or I don't know how to do it or whatever they think about it. So
Yeah.
so yeah, it's all of that certainly. I mean, that's a lot right there, right?
Yeah.
And then you layer in medications and stuff. The way that the medical system works is very much the opposite. Like here's medicines and then yeah, the last 30 seconds is, oh yeah, you should probably exercise a little bit more.
Yeah.
Um
Eat
and
less, move more is
yeah,
what, yeah. Uh-huh.
yes.
I'm not
And
saying, I'm being sarcastic, just to clarify, in case you're not seeing me. I'm being
yeah.
sarcastic there. Yes.
And again, I think as a provider, often the majority of patients, that's what they think has to happen in this relationship, and it's absolutely fine, and I am there for it because I also know that access to those types of things are sometimes really challenging to find. But again, I don't just want to leave it there. So all those lifestyle things are so important.
Yeah. And even when you say consistency, so it's interesting. I've never actually had a conversation like this with somebody on consistency. I'm usually the one just like talking into the microphone or my phone on it
Mhm.
or when in my coaching. But it's interesting because as you're saying that, I know that sometimes people think consistency means perfection.
Mm.
Consistency means all the time. Consistency is a very rigid idea, which can you expand on that, like a little dialogue on what that actually looks like in practice?
Sure. So I guess what I would tell someone what consistency means is, or maybe a way to look at it is getting rid of that like all or nothing or the perfection part of it. It's more like you're on this long journey, right? This whole thing is a marathon. It's not a sprint. And just because Sunday is Easter and you're going to have deviled eggs and cake and whatever, and maybe you're not even going to get in a workout that day because his family's around or what have you, it doesn't mean the whole day is ruined. And it doesn't mean that you have to wait till the next week to make anything different or even the next day. It's just looking at each and every opportunity as
Ooh,
new opportunity. Has
yes.
nothing to do with the decisions that you made earlier in the day or whatever. So like if you have time later in the day and you want to go for a walk, then go for a walk. Your day is not ruined. So I guess that's how I like to think of consistency, meaning like you're going back to that same plan, but you don't have to beat yourself up for not following that exactly.
Yeah.
Or I'd rather that people just enjoy their indulging so that they can then be done, like just be done and move on
Yes.
with it. Because I feel like that guilt spiral is then what like throws everything off, right? Once
Mm-hmm.
you're just like, yeah, I really enjoyed that cake or the whatever, and yep, and now I'm going to go for an evening walk, and tomorrow I'm going to start again. So,
Yeah.
yeah,
It's almost like there is this expectation that we have been. I'm even thinking, like, where the hell did this even come from? I, I don't know. Like, I don't ever remember hearing that things need to be perfect, but it is interesting to think, like, where did this idea come from? But almost like we're expected to live in the absence of life. That, like,
mm-hmm.
you're going to be given opportunities to have delicious treats. Or like yesterday, we got my husband, he's not here, and he sent us takeout and he sent me like a key lime pie.
Mm,
I was not expecting that, but do you think hell yeah, I ate that thing. I was like, this is
yeah,
the best. But there was a time in my life where I would have been like, oh, I
can't eat that.
can't eat that, or I should only have a couple bites of that. Like, that is just not a fun way to experience life. And
Right.
I love how you said like the next opportunity. Our days are filled with opportunities
Mm-hmm.
to do anything we want, to eat the pie or go for a walk or do the workout or get up early or sleep in. You know, my kids are on spring break. I am sleeping in later this week. I am not getting up early. Like, no,
Yeah.
thank you. You know, there's opportunities for all sorts of ways to be with our bodies and be with food. And this idea of a certain way to do it for every person is just so outdated and not needed.
Mm-hmm. Mm-hmm. Yeah. And I think part of that is that restriction type of diet culture that is still there. I feel like it's better than it was, but still hear that all the time. Like exactly that. Like I can't have that pie. I'm on a diet
Yeah.
or I'm trying to lose weight or whatever. And it's like, okay, but you're still like a person and you're living. Now, yes, do I think every single day you should have key lime pie if somebody brings it in? No. But I think you'd be less inclined to do that if you truly enjoyed that key lime pie, had
Mhm.
the first day instead of feeling guilty and shameful and I didn't, like that.
Yeah. Yeah, I know. I too feel like it's changing. And also, I talked about this with Lexi Bennell. It was the kind of repackaging of the language to sound better, but kind of
Mm-hmm.
still has the undercurrents of toxicity. It's just repackaged with better words,
Mm,
which is a tricky. We kind of talked about this when we met for lunch, where it's like this tricky, where it's like the language that we're hearing, we have to kind of walk this line because I hate this stuff so much. Like I hate it. And also to make the connections with people, you kind of have to speak the language and then, okay, let's start kind of untethering some of these well-worn connections that we have between how we should be or the food we should be or how we, like even the
right.
exercise and movement. It's like some people they don't like they think of exercise and it's like that stuff I used to torture myself with,
Mm-hmm.
20 years ago where it's like, no, we can just eat well and be
Mm-hmm.
well and move well and be happy beings. Like
Yeah.
that is what we should do.
Mm-hmm. Yeah.
Okay. All right. So, talking about weight gain, here we go to the first question that I had for you. And this is okay. So, I was actually curious about this because I do not know this answer. Is there a reason in menopause, like a medical reason that would be helpful in perimenopause and menopause to have weight gain? I mean, is there biologically something good for women to have extra weight gain?
Biologically a positive reason. Honestly, I think that what has happened is that we are now living well beyond a point
Yeah.
in time where like it didn't matter before, right? Because we were probably just making it to that point.
Yeah.
And so if you died at 56, you lived a long life.
Yeah.
And like, I know that sounds crazy, but it honestly, it wasn't, it was like probably less than 100 years ago that was the case. So in the big picture of like how long humans have been around, it's just like a tiny little bit of our history. And so I don't, maybe if we humans are allowed to be on this planet for thousands of years longer than we are now, maybe we will evolve and something will change there. But I think probably it's like, again, our, ovarian function starts to decline, but yet we are here, we are still alive. And so unfortunately, I think it's the opposite that it does, like there are certainly biological reasons why the weight gain happens, and then what that means for us as far as like chronic diseases and risk and things like that.
Yeah.
Yeah. I mean, like in females, right? Generally speaking, hips and lower abdomen, carrying weight there, yes, biologically that does make sense. I think it's more just, again, like I said, that we're outliving.
All right. Because as I was like thinking about this, I'm like, wait, is this just because of society wants us to be like, I went down my whole patriarchy.
Well, but that is the other thing though. Yes. I think what's wonderful, the no more fucks given kind of point in time that you get to when you're in your is usually, I wish I could have felt like that in my 30s and beyond, is that now I really feel like when I talk to women about their bodies, it's a little bit easier to get them to buy into like, you were never supposed to look like whatever you fill in the blank thought your body was supposed to look like. And that's why you feel the way that you feel now, because you spent the last 30, 20 years fighting what your body was supposed to be like, because of what we're told we're supposed to look like. So I think that's one of the wonderful things about midlife is like, hopefully we can get to a place where we just are accepting of our body, that it's going to look and feel a little bit different, and it can still be very healthy.
Yes. Okay. All right. Thank you for that. Because I was like, I wonder, but that makes a complete sense. And I love being this age. Speaking of like in the 40s, there's so many times, I think I saw somebody recently that I knew in my early 20s, and I'm like, I wonder if they think I'm still like that person. Because I wish I had who I am now back in my 20s. I would have been so cool. I would have just been mouthing off though, probably just telling people off instead of letting people do things like to me. I would have been like,
I know. That's my hope for my daughters, that they will get there faster. But honestly, I don't know. Is that just the natural, trajectory of things? Yeah. I mean, there are wonderful examples of women and that who are young women who you're like, holy smokes, like how did you get to be that brave or that intelligent or wise,
Yes.
So
yeah, I'm hoping the same with my girls. It's like, okay, let's try to buy. I know that there's learning in the what we went through, but also if I can get them to bypass more of that and have more of what I found in my 40s and late 30s, I would like them to have that.
Yes.
Okay, so here we go. Question number 1. Why am I gaining weight even though I'm doing the same things? I hear all the time.
Yeah. I mean, I think it's because of the second half of the question, because you're doing the same things. And again, biologically, everything's changing. So it's not just hot flashes, to be cliche. It's not just hot flashes. There are real biological changes that include things like our fat distribution and type of fat. And this is going to happen whether you are on the treadmill 90 minutes a day or not, because it's not about what you're doing. It's about like what's happening inside biologically. To a degree, you can't really change that 100%. doing the same things when your body is literally changing. It's not going to work. And so you can't just out cardio it or whatever, or just keep restricting and keep restricting and keep restricting. You just need a whole new strategy. And I know that's like sometimes hard to come to terms with, or we don't want to. Sometimes we just get really comfortable with our routine. And yes, it has worked for a long time, but yeah, I think that's the big piece of it, is that you probably just need a whole different strategy. And we also may need to get a different picture of what healthy looks like.
Yeah. Okay. So this is kind of, I'm not going to say sad to say. I've never heard anybody say that before. I've never heard anybody say it's because you're doing the same things. So what does that, when I'm in this field, like not your field, I'm in that does what I do. So what does that look like? I mean, let's just take me, for example. And I don't have a lot of the things that the women I work with, the experiences that they have. But for the last 3 years, and then before that, when I had the gym, it was hard for me to work out. I work out 5 days a week pretty consistently. I strength train some portion, 20 to 40 minutes in each of those times. I walk most afternoons as long as my walking buddy is not gone, because when she's gone, my steps go down to like 4,000 and not like 12. And I've eaten the same way there is not really anything that has changed, and I am very consistent. I'm a Taurus. I like things to be the same. I am very like grounded in what I do in my habits. So for a person that is like, and I'm not trying to do the quote unquote right things. I'm just doing the things that I know are good for my body. But when the things that I'm doing that are good for my body are shifting, like what does that look like? And how do you know what to do?
So then what I'm hearing, right, is, I know you said you're not trying to do the right things, but I'm hearing that you're doing the right things, right?
Naturally, I'm doing the right things.
It's right. You're doing all the things. And so then I guess the question would be more like, what do you see that needs to change? Trying to get to the specifics of it. And obviously might be talking about you, but like each person, that's going to be different. Maybe it's like, I feel really tired, or my jeans my clothes don't fit the same, or whatever, trying to really boil down to like, okay, but what is it other than I just am gaining weight, if that's, what we're talking about, that we try to get at. Because if it's just that my clothes aren't fitting the same way, well, then maybe we need to do something like a body composition and see where you're at. Because just looking at the scale or looking at how your clothes are fitting, that's only like a little portion of it. But if you do a body composition analysis and you see that, you are carrying significantly more fat, it's just probably distributed differently now, and less muscle mass, then you have a lot more insight into what could potentially be adjusted or be changed, versus if somebody gets a body composition analysis and you are like, you have a wonderful amount of lean body mass, then the question becomes like, well, do you want to like really change your physique and know that is going to take like concentrated, specific effort? Or are you okay with knowing, that you're in a really good place, that you are doing the things? Yes, your body's starting to shift and change, but again, that goes back to biology. But when we look at like your labs, or we look at your body composition or whatever, you are healthy. So, I think it's just each person, but that is where those kind of tests are incredibly helpful.
Yeah. Like a DEXA, is that what you mean?
So a DEXA is the gold standard, but you have to, there are only certain places. Like if you just go to the hospital and you get like a DEXA from your doctor, the hospital ones, as far as I know, I don't know anyone who's doing the full body composition analysis. Like the report that we get back is, it just talks about your bones.
Okay.
And because that was the original use, right? DEXAs were used for body composition analysis, more for like research. But now, of course, we know that. And so there are places where you can go and they will get you the full analysis. So DEXA is like the gold standard for that. Okay. But even, like body pods or like I have a Hume home scale or whatever.
Okay.
They're not perfect. You have to know what things can throw them off and stuff like that. And then being consistent, because again, it's not just like, I'm going to look at it now and then I won't test it for 3 more months and see what happens.
Yeah.
Kind of using it a bit more consistently, especially if you are trying to, make changes there. But I've looked into it, like my area. There are a few places that offer, again, that full DEXA body scan, and it's like $100 or something
it's not
like
that
that.
bad.
So,
And they can do, I have a handful of clients that do it because there's one locally here. And I usually try to have them go quarterly where they can get a good kind of reading on. I think they also have a plan where you can go monthly or something, but I feel like
that might be overkill.
Not all of them need to do something like that. So let's say I'm going to keep going with that because I recently had one of my clients who did that, and she found out that she has osteopenia. She is in her mid 50s. What does that look like? Because that was one of the questions I have on here. If somebody takes one of those scans and finds out, okay, I'm losing bone density, how can working with someone like you, and how can potentially hormone replacement or diet, or what does that look like? And is that reversible?
So the simple answer of, is that reversible? Yes. The other thing that I do want to say is the most decline in bone health, or the most rapid decline, typically is in that initial 5 years after menopause. So what is great, and the way insurance doesn't work, but what is great for women if they are educated and want to try to avoid that, is having a body composition or a DEXA scan before they are in menopause.
Yeah. Okay.
So that you are like, okay, I know where I stand, even if we're just talking about bones. And then, at the time of menopause, or if not before then, so that, again, you're like, okay, here's what's happening. Their estrogen, bioidentical estrogen, is a good and a great way for women to prevent osteoporosis. So osteoporosis is the actual chronic condition that sets people up for increased risk of fractures and debility and, mortality.
Yeah. Did I see? I just want to. Did I see something that said if you have like a fall and a hip fracture, the likelihood of death is like a year from that? Is that? I don't know where I saw that, so I don't know if it's accurate. But is there are?
Yeah, I can't remember. That, right? Yes, I can't remember the exact statistic, but yes, it's like a third of the women that end up with a hip fracture, and I think it's like after a certain age, will not return home. And that may be because they end up in a nursing home or because they die. Yes, that death from hip fracture, I think, typically does happen within that first year. So it's the point of all of that is, and I wish I was better with those statistics, but
it's okay. I just it is out there, and we don't want that to happen.
Yes, but it's knowing that this is not just, I feel like it's always just been like, oh yeah, your bones get weaker and, you might have fractures or whatever, but nobody talks about how serious, or hasn't been talking about it until recently, how serious that actually is. And so if any woman just wants to start hormone therapy just to protect their bone health, by all means, they should.
I mean, that's a really important reason, really important.
Yeah. There's another statistic, again, and I'm not going to remember it exactly right. Dr. Vonda Wright, she talks about it all the time. And it's like the statistic of how actually frequent it is that women will end up with significant osteoporosis related fractures, in their older years. And it's like a lot of us will. And I wish I had that statistic.
It's okay.
In my head,
we have Google. These things we can Google.
But it's really significant. So anyways, sorry, back to
That's okay. We need this information.
Okay. So we were talking about the woman who gets a DEXA and has osteopenia. And so for anyone who doesn't know, osteopenia basically means that you are at risk for osteoporosis. They've kind of renamed it so it's low bone density. That is reversible. Estrogen can help with it. There are some osteoporosis medications that you may qualify for depending on how bad that score is or how quickly it's changing, right? If it's like worsening pretty rapidly. But, of course, those are medications. They have numerous other potential side effects. So, something to have a serious conversation about with
Yeah.
your provider. Especially if a woman's in menopause and having other symptoms, again, something like bioidentical estrogen may be a wonderful option for them. And then you certainly can and should do things like weight training. And a big one, again, Dr. Bonda Wright, she's great if you need to follow somebody specifically about bone health and stuff. She does a lot of research there. But doing jumping, and even if you can't jump, right, if you're not in a place to jump yet or ever, doing things like heel drops, and again, that weight training, those are excellent ways to strengthen the bone. They aren't going to be as significant as something like estrogen, but even if somebody says I'd like to be on estrogen, we still would like to have them incorporate those other things, because it's usually about the combination of things that we're doing.
Yes. I saw something that said about like stomping up the stairs to help with bone density. And I was like, oh, okay. So my husband is doing a great job of like ensuring. Me, on the other hand, I'm like tiptoeing. So I'm so quiet because I don't like the sound of it. But I'm like, okay, maybe I'll just start stomping up the stairs like everybody else in my house. But I might need something for the irritability because it drives me insane. I laughed at that one. All right. So, one of the things that I know that I shared with you, and I've talked about it on here, I do a group that I work with women who are taking a GLP-1 as far as habits and lifestyle. I don't do the medical part of it because I stay in my lane on that. But how would that work also with taking an HRT or working with somebody like you? Like, how do these pair together? And are there benefits, risks, anything like that?
So there does not seem to be any interaction that's negative with those types of medications, like any sort of menopausal hormone therapy and GLP-1. So that's the very positive side of it. Obviously, like knowing risks and benefits of the menopausal hormone therapy, and then same with the GLP-1s. But once you get beyond that piece of it, I think the word that we often use in the medical world is synergistic. So I think they can have a very good synergistic relationships where they kind of help one another, because a lot of just disease and illness and symptoms comes down to some degree of inflammation in the body. And that's the very interesting piece that we have realized that is probably the real driver and benefit of the GLP-1 medications. Of course, it helps with appetite and things like that, but those are probably like really initial. And that inflammation piece is kind of like what's happening underneath all of that. And then that speaks to why these types of medications may be helpful for, and I don't want to say it like thin, but when we look at actual definitions of like having overweight and having obesity, probably if people actually looked at where they fall in there, they may be in one of those categories, yet, generally still feel pretty healthy. And that's because you can be. But just the nature of having overweight or having obesity means that there's this level of inflammation in the body, which unfortunately can lead to things like joint pain, diabetes, heart disease, et cetera, when it's left unchecked for years and years. So using a medication like a GLP-1, I think really helps a lot with that. And also why I think people just feel a lot different when they can tolerate those medications. I think they are very helpful for people, and they just begin to feel a lot different. And it's probably a lot of the inflammation. And then for the menopausal hormone therapy, because it's giving you especially when you're using those bioidentical or body identical hormones, it's giving you back what your body had been using to protect against inflammation.
Yeah.
And these biological changes that are happening. So when you're giving, and we're not putting values back to what they were when you were in your 20s, but we're giving you back enough that it seems to like curtail that a little bit or slow that progression of inflammation. So again, I think that's why those two things together actually can be very beneficial.
Yeah.
And that doesn't mean that every woman needs or should
Oh, no.
be on
Yeah.
that, right?
No.
But
No, we all got to do our own thing. I know that when I started microdosing the GLP-1, that was the inflammation. I mean, it was it was remarkable. It was just remarkable. And that was one of the things I struggled with, because I'm like, I know that I'm doing the things to not have all of this inflammation, and not everything. I mean, I do like my wine. So that was one of the things where it's like, okay, I know this isn't great, but it was like, it was wild to me how much it supported me with reducing the inflammation. Okay. Okay. Excellent. So last question that I have, unless we kind of move someplace else, but this was for somebody, was if there is a risk of breast cancer, and perhaps there has been a parent or a close relative that has had breast cancer, died from breast cancer, if that risk is elevated, what does that look like as far as taking a hormone replacement?
So the first thing I would say is family history is definitely not a contraindication. So that's the word we use that says that you should not be on something. And so a family history is never a contraindication. Personal history is also, well, personal history of breast cancer, yeah, that's a whole other ball of wax. But like, let's say, for example, someone had genetic testing or goes to a high risk breast clinic, because I guess the other thing I should say is there's a difference between like, my mom had breast cancer at 70 versus, my mom had breast cancer at 45 and my cousin, and, like that.
Okay.
That's different. It's going to be handled different by your primary. Those women are much more likely to be seeing the high risk breast clinic, to have genetic testing, et cetera. Again, even still, there isn't any evidence that giving that woman estrogen or progesterone will cause breast cancer. It's just a more nuanced conversation with that woman about making sure that she's doing all the things that she would be doing to screen early. Because in women like that, again, their screenings are very different than the average, just yearly mammogram at a certain age. The conversation is definitely more nuanced, and the decision is very individualized. When you look back at the studies, like specifically the WHI study, the Women's Health Initiative, they used a synthetic estrogen, and it was oral. So that's a little different too. But even when they gave that to women who had had a hysterectomy, when you looked at the overall data, they had a slightly decreased risk of breast cancer. And when we look at other studies, more like observational studies of women on menopausal hormone therapy in general, they tend to have, if they do get diagnosed with breast cancer at some point, they do tend to have a better prognosis and just overall better mortality, or like living longer. So again, no one's like done the study of like, here, you have these exact genetic markers, you take this, you don't, and then we're gonna, follow you along. So we really have to use meta-analysis, pool large data from all different types of studies and observe those that are and those that aren't, and what are their, individual risk factors. And then also keep in mind that cancer is a lot more complicated. It is never just one thing, right? So when I hear women that say like, my mom told me, or my aunt told me, or I know that, I was told that my cancer came from the hormones or whatever, it's like, whoever said that to you is like, number one, there's no way for them to prove that. So like, okay. And second of all, like, what about all the other stuff, right? What about the fact that you had a family history? What about the fact that like everything in our lives now is doing something good, bad, or otherwise to us internally, right? Everything we put on our body, every food that we're eating, phones that we carry, like, and I'm not trying
Careful,
to say
I
like
will go
these things.
crazy.
No, I'm not trying to say that. I'm just saying like
Yes,
there's
there are
there's
other.
way more things that go into cancer than just, someone who is taking hormones.
Yeah.
Yeah.
Yeah. Okay. So what types of things, I mean, is there a good, you said a clinic. So what kinds of things, because a lot of times like you said, they get this information from somebody in their family, and that's not the situation I'm talking about, but they get information and then they are like, it kind of solidifies in their mind. So how can we start kind of untethering these things, and what kind of provider should they be kind of either marrying together, or what does that look like? And not
And this
necessarily just for this, but just in general, what does that look like? Because we've just been told things that are not actually true all the time.
mhm. I mean, honestly, where I would start is, if people are willing to either listen to an audiobook or, read a book, there are amazing books on these exact subjects
Okay.
that I think provide a lot of information, a lot of reassurance, a lot of this detail. Some are so like the book Estrogen Matters is a fantastic book. It may be a little dense for the average non-medical person, but maybe they want that.
Yeah.
And so that's a really good. Avram Blooming is the physician that wrote that, and he goes into tons of detail of studies and things like that. So there's that. But then even, books by Dr. Mary Claire Haver, Dr. Heather Hirsch, Dr. Kelly Casperson, Dr. Vonda Wright. Again, these are all physicians of different types. That even right there, that was an OBGYN, an internist, orthopedic surgeon, and a urologist. But they're, again, all different ways of coming at learning about menopause because it affects so many systems. But what's nice is they tell it in different ways, but it's all the same information. So
Yeah.
once you start seeing that, you're like, okay, so like the people who are like learning this, doing their own, like Dr. Vonda Wright still does her own type of research and stuff, looking at all the data, et cetera, they're all saying very similar things. And then the Menopause Society, they also do a lot. They do a lot for the providers, of course, but they do for the community and things too. So there's patient resources on there that you can access. I think they do webinars for the public too, I think. So
Okay.
yeah, those are good resources. And I think once women start to hear that from trusted sources that's not inconsistent and all over the place, I think that helps too.
Yeah. This feels manageable. I
Good.
don't think I've ever kind of felt this before. And again, like this, mostly because when I'm talking with women that I'm working with or just friends, it always seems like there's a big question mark in between. Like if they're like they talk about like the elephant in the room, like this seems like
Mhm,
just a big question mark in the room of like,
mhm.
what the hell? But like after this conversation with you, it just seems like there has been like the curtains pulled back, like there's more clarity to
Good.
it.
Good. I think a lot of it is because at least so like the generation before us, Dr. Kelly Casperson always says boomers should be pissed. And I love that because it's true. Like they unfortunately, the majority of them are past this like window that we talk about, and they just did kind of like have to deal with it and whatever, and they eventually realized something was not right, but now they're like, well, so much for that. They should be pissed. And then our generation is like, I think, learning together, using our voices collectively together to be like, this is not okay. We need to do something about it. Providers need to be educated. They need to be teaching this in medical schools, and just women need this education. We need better sex education. We need better body education, all of it. And, it'll probably take a couple more generations, but my hope is that like when my 6-year-old gets to be, 40 years from now, she's going to know it's coming. and she's going to better be able to handle it. She's going to know who to go to talk to. And it's not going to be this big question mark. I think it's because it's all happening now is why that it is this. And so for us, it's like the working generation of, figuring it out.
That's really actually feels okay. You just like did a little mindset shift for me here. It always felt very frustrating. Like there's not enough information, but the way you just said it, the work that you're doing, you are a trailblazer. And I know that you probably already know this, but this is making it far less frustrating and pissed off for me that the information isn't already available, like readily. You're doing the work. You are the trailblazer for doing this work so that our daughters and their friends are going to have this. They are not going to have to do this. So that is so much more empowering for me as a person, and that you are doing this work, that we are the people, we are the workers, we are the we are, I'm just talking and asking questions.
But we are the workers.
It is our generation that is doing, we have to do this hard work. Okay. That's actually really helpful. And so after this, I'm realizing a couple things which have nothing to do with this and everything to do with this. The clarity has come from just having the conversation. And I don't think that these conversations happen enough. And I know that you do workshops, and I know that that's why we met for lunch, because you were doing a workshop here locally. But if we're not having these conversations with people who are educated and having them, that's why we're left confused. And you are blazing a trail for us all having this conversation. So those of us, me, that we don't know, it is our responsibility to be connected with women like you and people who are writing these books and doing this work so that we can absorb this information and then have these conversations and make it more okay that we're having these conversations, less about why we're so confused and trying to make sense of putting all the puzzle pieces together and just kind of gathering. But I am now less pissed off about this.
Okay.
Thank you.
Good.
Thank you.
The one thing too, when you mentioned, so I did that workshop or talk earlier in the week in Madison, and I was having a conversation with a woman there, and I said, I think another piece of it is traditionally when someone thought of a menopausal woman, like, just close your eyes, think of a menopausal woman. What are you picturing? Right?
She's old.
Yes, right. She probably has gray hair, lots of wrinkles. Maybe she's sitting in a rocking chair, okay. So then when you're in your 40s, you're like, is this happening to me? I don't know, because I'm not that old lady sitting in a rocking chair. Yes, exactly. Even again, I think it's Dr. Kelly Casperson. She's hilarious. If nobody listens to her yet, you should. She's so funny. And she just has great ways of saying things, but that it needs rebranding, right? My husband does branding. Maybe he should rebrand menopause, but, but it does, because again, even the word menopause already has this vision, this connotation, everything about it, so that women who it's actually happening to in their 40s and 50s are like, but I'm not this old, whatever. So I don't know. Or we have to use that word and just reclaim it and, be like, that's not what that means, Yeah.
So. No, I think it needs a rebrand, because I saw, the Golden Girls. There was this clip that was I think it's is it Blair or Blanche is the one that was the
Blanche, I think.
Okay.
Yes.
And I'm 45 years old and I'm this, and she looks like she's 85. And to think of that, that is my vision, is her, but she doesn't look, I am going to be 45 in a month. That is not at all
I don't see myself that way.
100% no. Yeah, the rebrand. Ooh, I love that, actually. Okay. Because it needs a cool vibe. Because
exactly. Because the people who it's actually happening to are in the prime of their life. Yes. So whatever the rebrand is, it's we're at our pinnacle here.
100%.
And I'm not saying we're just going to, I just mean we're going to
just
plateau
upwards, onwards and upwards.
Up. Yeah, exactly.
That's really powerful. All right, honey, I have a new project for you.
Yeah, right. We need an overhaul of menopause.
Right? I feel like you guys could do it. You get a powerhouse there.
Most things were named after some old white man. So why couldn't new things be named after powerful midlife woman, right?
Yeah. Yes. Yes. Oh, I love that. All right. Thank you so much.
Absolutely. Thank
This
you
was,
for having me back.
yeah, really powerful. And I really do hope that women feel they listen to this. I'm like, it almost feels like we have like, not a cape, but like that like power stance where it's like, hell yeah. Like
Mm-hmm.
this is,
Yeah.
we are the trailblazers of this. So
Right.
let's own this
Yeah.
shit, ladies.
Mm-hmm.
Let's start the rebrand. The rebrand starts here on this
Okay.
episode. All right. Thank you so much. And I'm going to do my best to put a lot of the resources you mentioned in the show notes. But if you all heard
Okay.
something, you might have to just go rewind and pause it and write them down because there was a lot. So thank you for that. But
Yeah,
I will try to
absolutely.
get some of them in there along with your contact information because I think the more women that we can get in your kind of circle and in your sphere of support and helping, the better, because we all need clear minds and all the things to go out and do the good shit in the world. So thank you.
Yep. Thank you.
Awesome. Have a good day.
Thanks.
Spirit of a Badass is a Lit Path Studios podcast and is produced by Jamie Gale and Alecia Jacobson. Music by Shane Ivers. We'll be back with another inspiring interview. Until then, keep your spirits high and your energy badass.